typically varicose veins, are caused from the faulty valves. There are valves in the veins in our legs, and there's three major venous systems in our legs: the deep veins, the superficial veins, and the perforating veins that connect those two. They all have valves in them that are supposed to prevent the backward flow of blood. So when something damages those valves, typically it's an inherited disorder, but it can be for many. I've seen patients that come in the office, they got hit in the leg with a softball, and then they start to develop varicose veins. It's from damage to the valves. It seems like every day somebody's coming out with something different to treat venous insufficiency and varicose veins. But the latest and greatest is it's been around for quite a while now. So we have radiofrequency ablation. That is my preferred treatment modality. That's just a small catheter with a gold tip on it that heats the vein up. But we also have non-thermal methods of shutting the veins down. And that includes things like VenaSeal. That's where we inject cyanoacrylate glue. It's like super glue. We put a small catheter inside the vein, and we inject the glue. We push the vein down, and it's like we're sealing an envelope. The glue causes the vein to adhere to itself, and we do that the entire length of the vein, and that closes the vein down nicely. The beautiful part of using VenaSeal is there's no tumescent anesthesia. We don't have to put all that numbing medicine in your leg. We just have to numb up one spot where we get in the vein. And number two, you don't have to wear compression stockings after we do a VenaSeal. So you can go right back to your daily activities. You could go run a marathon if you wanted after using the glue. So it's an excellent technology. Some patients are allergic to adhesive, so it may not be a good choice. Some patients don't like to have, it is considered a permanent implant. The glue will be in your body for the rest of your life. So that turns some patients off. But I think it's a fantastic option for patients. It can almost be a lunchtime procedure. You come over to the clinic, we shut your veins down with the glue, and you go back to work. So that's the nice part of the VenaSeal. We have Claravane, which is also called a mechanical chemical ablation of the vein. And that's where we inject a solution called a sclerosing material. We inject that sclerosant directly into the vein. And then the Claravane is basically it's a spiral wire, if you think about it, and it turns and it irritates the vein from inside. That causes the vein to spasm. And then it's the combination of the vein spasming down and the combination of the sclerosant, which closes the vein. So it's another great technique to use to close the veins. I do a lot of microflebectomy, and what that involves is I make a small hole in the skin instead of making an incision. I make a small hole in the skin, and we go in with a vein hook. It looks like a crochet needle, and we pull the vein out through that little hole. We just keep tugging on it till it breaks off. Then we make another hole. So we're kind of piecemealing the vein out. That results in a very nice cosmetic appearance of the leg. I use it frequently in patients that have very big, ropey type of veins that you can see. So that's a nice treatment option for patients. They're working on endovenous microwave ablation now. I am not familiar with that. It's relatively new, but it's just another way of closing the vein down with heat. And then finally, we have sclerosants, like we talked about, that we can inject inside the vein. It causes an inflammatory reaction in the vein and shuts that vein down, prevents that backward flow of blood.